Alprazolam is a triazolobenzodiazepine with intermediate onset commonly used to treat panic disorders and generalized anxiety in addition to anxiety associated with depression. In this video, let's found. What is alprazolam? What is alprazolam used for? Contraindication. What are the side effects of taking alprazolam? How does alprazolam work? How to use alprazolam? What is alprazolam? Alprazolam, sold under the brand name Xanax, is a fast-acting, potent tranquilizer of moderate duration within the triazolobenzodiazepine group of chemicals called benzodiazepines. Alprazolam is most commonly used in management of anxiety disorders, specifically panic disorder or generalized anxiety disorder, GAD. Alprazolam was invented at the Upjohn Company and patented in 1971 and approved for medical use in the United States in 1981. Alprazolam is a Schedule IV controlled substance and is a common drug of abuse. It is available as a generic medication. In 2020, it was the 37th most commonly prescribed medication in the United States, with more than 16 million prescriptions. What is alprazolam used for? Alprazolam is indicated for the acute treatment of generalized anxiety disorder in adults. Alprazolam is also indicated either as a standard or extended-release formulation for the treatment of panic disorder with or without agoraphobia in adults. Alprazolam may also be prescribed off-label for insomnia, premenstrual syndrome, and depression. Contraindication. Alprazolam should be avoided or carefully monitored by medical professionals in individuals with myasthenia gravis, acute narrow-angle glaucoma, severe liver deficiencies such as cirrhosis, severe sleep apnea, pre-existing respiratory depression, marked neuromuscular respiratory, acute pulmonary insufficiency, chronic psychosis, hypersensitivity, allergy to alprazolam or other benzodiazepines, and borderline personality disorder, where it may induce suicidality and discontrol. Side effects: drowsiness, lightheadedness, headache, tiredness, dizziness, irritability, talkativeness, difficulty concentrating. Pharmacodynamic. Alprazolam is a benzodiazepine that binds gamma-aminobutyric acid, GABA, type A receptors, GABAs, to enhance their inhibitory effect on neurotransmission, specifically in the brain. Concomitant use with opioids may result in profound sedation, respiratory depression, and death. Patients taking benzodiazepines and opioids concurrently may require lower doses of one or both medications, depending on their clinical situation. Patients with pre-existing impaired respiratory function are at increased risk of adverse effects, including death during treatment with benzodiazepines. In addition, due to its CNS depressant effects, patients taking alprazolam should avoid operating heavy machinery or driving and should avoid other CNS depressants such as alcohol. As with other benzodiazepines, alprazolam carries a risk of abuse, misuse, and addiction, which is higher in predisposed individuals and may restrict monitoring. Cessation of therapy may result in acute or protracted withdrawal symptoms, which may be life-threatening. The patient dose should be gradually tapered whenever discontinuation or reduced dosage are necessary. Newborns born to mothers using alprazolam later in pregnancy may suffer from sedation or withdrawal symptoms. As CYP3A is required for the initial step in alprazolam metabolism, alprazolam is contraindicated in patients taking strong CYP3A inhibitors, such as ketoconazole and itraconazole. Milder CYP3A inhibitors still necessitate alprazolam dosage adjustments. Lastly, benzodiazepines may have negative effects, such as panic disorders, increased suicide incidents, and episodes of mania/hypomania in patients suffering from depression. Mechanism of action. Neurotransmission relies on excitatory and inhibitory signaling. Gamma-aminobutyric acid, GABA, type A receptors, GABAs, are members of the pentameric ligand-gated ion channel, PLGIC, superfamily located synaptically and perisynaptically to mediate inhibition and extrasynaptically to mediate tonic inhibition. GABAs comprise a variety of subunits from a homologous family whose members are named based on sequence identity as one of alpha-1,6, beta-1,3, gamma-1,3, delta, epsilon, theta, pi, and rho-1,3. Each sub possesses an extracellular, ECD, transmembrane, TMD, and intracellular, ICD, domain. Intersubunit interfaces are the primary points of neurotransmitter and modulator binding, described by coordination of the principal, plus, and complementary, sites in each subunit. Binding of GABAs induces pore opening, rapid flow of chloride ions, and synaptic hyperpolarization, which in turn manifests as an inhibitory signal. The exact manner in which GABA allosteric modulation mediates the therapeutic and unwanted effects of benzodiazepines remains unclear. Earlier studies suggest the primary factor was the alpha subunit composition, with alpha-1 containing receptors mediating the sedative effects, alpha-2/3 containing receptors the anxiolytic effects, and alpha-5 containing receptors the memory effects of benzodiazepines. More recent studies suggest a more complex set of factors being subunit composition, physiological location, neuronal circuit, and nerve cell type. To further complicate matters, there may be up to 5 distinct BZD binding sites on GABAs, with site 1 corresponding to the classical high-affinity alpha+/gamma interface. The effects of binding at sites 2 to 4 are not fully understood and likely impart greater complexity to benzodiazepine pharmacological action. Half-life. Alprazolam has a mean plasma elimination half-life of 11.2 hours in healthy patients, range 6.3 to 26.9 hours. The mean half-life is 16.3 hours, range 9.0 to 26.9 hours, in the elderly, 21.8 hours, range 9.9 to 40.4 hours, in obese patients, and 19.7 hours, range 5.8 to 65.3 hours, in patients with alcoholic liver disease. The half-life is 25% higher in Asian patients, compared to Caucasians. Other studies have shown the half-life to be 9-16H. The extended-release formulation has a half-life of 10.7 to 15.8 hours in healthy adult patients. Dose. Anxiety. 0.25 to 0.5 mg, PO, Q6-8HR, titrate to effect Q3-4 days, not to exceed 4 mg per day. Panic disorder. Immediate release. 0.5 mg, POQ8HR, may increase Q3-4 days by less than or equal to 1 mg per day. Average dose, 5 to 6 mg/day PO. May require up to 10 mg per day PO divided Q8HR. Extended release. 0.5 to 1 mg PO Q-day, may increase Q3-4 days by less than or equal to 1 mg per day. Average dose, 3 to 6 mg, PO Q-day. Anxiety associated with depression. 1 to 4 mg/day PO, divided Q8HR. Premenstrual syndrome, off-label. 0.25 mg PO, Q6-12HR, initiate treatment on day 16 to 18 of menses, not to exceed 3 to 4 mg/day, taper dose over 2 to 3 days once menses occurs. Safety advice. It's a pregnancy category D drug, which means it can harm your pregnancy. The effects on a pregnancy depend on when in the pregnancy you take Xanax. It can cause serious problems throughout your entire pregnancy, though, so you should avoid it during all 3 trimesters. That's all the information about Alprazolam we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.